Exercise always leads to extra energy expenditure, and glucose is always a contributor. In people without diabetes, the fuels used to meet this increased energy demand are regulated automatically. But as we've seen in previous modules, when you have type 1 diabetes, there are lots of different things to consider when attempting to regulate the use of body fuel stores. Even with advanced blood glucose monitoring and insulin delivery devices, this can sometimes feel like you're trying to paint a single pinstripe with a monster paintbrush. The key objective around exercise is trying to achieve an effective ratio between insulin and the body's counter-regulatory hormones. These include glucagon, cortisol, growth hormone, and the catecholamines, or stress hormones. Even with appropriate adjustment of injected or pumped insulin, the most common acute problem for people with type 1 diabetes during exercise is getting caught out with too much relative active insulin on board. This is mainly because the effects of insulin adjustment are never realised immediately. As I explained in Module 3, having too much active insulin on board at any time, and especially during exercise, inhibits the liver glucose production that normally replaces the glucose drawn from blood to fuel exercise. This, combined with increased insulin sensitivity and contraction-mediated glucose uptake into muscle, can result in hyperglycemia within 20 to 60 minutes after starting exercise. For most of us with type 1, this means it's usually essential to consume extra, suitable carbohydrate during exercise to maintain safe blood glucose levels. This is particularly so if exercise is spontaneous and pre-exercise insulin adjustment isn't possible. All exercise consumes extra energy, and as I explained in the basic physiology module, the body produces energy for exercise primarily by breaking down glucose and fat. I call this the energy mix. I also use the term X-carbs to represent the overall carbohydrate portion of the exercise energy mix. X-carbs represents the sum of the muscle glycogen plus liver glycogen plus blood glucose used to fuel exercise. Credit for coming up with the term X-carbs belongs to the authors of Pumping Insulin, John Walsh and Ruth Roberts. I've seen other terms used over the years like exercise exchanges, but I think X-carbs really helps you get your head around the overall carb cost of exercise concept and why it needs to be managed before, during and after exercise.